Every year, millions of women around the world hear the words, "You have breast cancer." For many, this diagnosis comes as a shock, not only because of fear, but because breast cancer often develops silently, without obvious symptoms in its early stages. Yet breast cancer is also one of the most researched and treatable cancers in modern medicine. Understanding how it develops and how doctors treat it can replace fear with clarity and confusion with informed hope. In this video, we will calmly and scientifically explain how breast cancer begins, how it grows, how doctors classify it, and how modern treatments are chosen. This information is educational, evidence-based, and designed to help patients and families better understand what is happening inside the body, without overwhelming or frightening imagery. What is breast cancer? Breast cancer begins when normal breast cells lose their ability to follow the body's natural growth controls. In healthy tissue, cells grow, divide, and die in a tightly regulated cycle. When this regulation breaks down, certain cells begin to divide uncontrollably. Over time, these abnormal cells can accumulate and form a mass called a tumor. Not all tumors are cancerous. A malignant tumor, which is cancer, has the ability to invade surrounding tissue and, in some cases, spread to other parts of the body. Breast tissue is made up primarily of lobules, which produce milk, and ducts, which carry milk to the nipple. Most breast cancers begin in these areas, particularly in the ducts. This is why the most common type of breast cancer is called ductal carcinoma. How breast cancer develops at the cellular level. Breast cancer does not appear overnight. It develops gradually, often over many years. The process usually begins with genetic changes inside a single breast cell. These changes, known as mutations, affect genes that control cell growth, repair, and death. Some mutations are inherited, such as changes in the BRCA1 or BRCA2 genes, which significantly increase breast cancer risk. However, most breast cancers are not inherited. Instead, they result from genetic damage that accumulates over time due to aging, hormonal exposure, environmental factors, and random cellular errors. As these abnormal cells divide, they may form precancerous changes, such as atypical hyperplasia. If additional mutations occur, the cells may progress to carcinoma in situ, meaning abnormal cells are present, but have not yet invaded surrounding tissue. Once cancer cells break through normal tissue boundaries, the disease becomes invasive breast cancer. Why breast cancer is different in every person. One of the most important things to understand is that breast cancer is not a single disease. Two women may both be diagnosed with breast cancer, yet their cancers can behave very differently. This is because breast cancer varies based on the type of cell involved, the genetic mutations within the tumor, the presence or absence of hormone receptors, how fast the cancer cells divide, whether the cancer has spread. Doctors now understand that breast cancer is a collection of biologically distinct diseases, which is why treatment must be personalized. Common types of breast cancer. The most common form is invasive ductal carcinoma, which begins in the milk ducts and spreads into surrounding tissue. Another common type is invasive lobular carcinoma, which begins in the lobules. There are also less common forms, including inflammatory breast cancer, triple-negative breast cancer, TE2, positive breast cancer. Each type has different characteristics and responds differently to treatment. This diversity is one reason why breast cancer care has become increasingly specialized. How breast cancer spreads. Cancer spreads when malignant cells break away from the primary tumor and travel through the lymphatic system or bloodstream. In breast cancer, the first place cancer often spreads is the lymph nodes under the arm, known as the axillary lymph nodes. If cancer cells enter the bloodstream, they may travel to distant organs such as the bones, liver, lungs, or brain. This process is called metastasis. Metastatic breast cancer is more complex to treat, but advances in therapy have significantly improved survival and quality of life. Breast cancer. Staging. Why it matters. Once breast cancer is diagnosed, doctors determine the stage of the disease. Staging describes the size of the tumor, whether lymph nodes are involved, whether the cancer has spread to other organs. Stages range from stage 0, which is non-invasive, to stage 4, which indicates metastatic disease. Staging helps doctors predict prognosis, choose appropriate treatments, avoid unnecessary therapies. Early-stage breast cancers often require less aggressive treatment and have very high survival rates. Hormone receptors and breast cancer biology. Many breast cancers are driven by hormones, particularly estrogen and progesterone. Cancer cells may have receptors on their surface that allow these hormones to stimulate growth. Doctors test tumors for estrogen receptors, ER, progesterone receptors, PR, HER2, protein overexpression. This information is critical because it determines which treatments are likely to work. Hormone receptor-positive cancers, for example, often respond well to hormone-blocking therapies. How doctors treat breast cancer. Breast cancer treatment is multidisciplinary, meaning it involves a team of specialists working together. The main treatment approaches include surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and immunotherapy. The goal is always the same: destroy cancer cells while preserving healthy tissue and quality of life. Removing the tumor surgery is often the first step in treatment. The goal is to remove the tumor and, if necessary, nearby lymph nodes. There are two main surgical approaches: lumpectomy, which removes the tumor, while preserving the breast; mastectomy, which removes the entire breast. Advances in surgical techniques now allow many women to choose breast-conserving surgery without compromising survival. Radiation therapy, targeting remaining cells. Radiation therapy uses high-energy X-rays to destroy cancer cells that may remain after surgery. It is a localized treatment, meaning it affects only the targeted area. Radiation significantly reduces the risk of recurrence and is commonly used after lumpectomy. Modern radiation techniques are precise and designed to minimize damage to surrounding healthy tissue. Chemotherapy, treating cancer. Throughout the body, chemotherapy uses medications that travel through the bloodstream to kill rapidly dividing cancer cells. It may be given before surgery to shrink tumors, after surgery to eliminate remaining cancer cells. In advanced disease to control spread, chemotherapy can have side effects because it also affects some healthy cells, but supportive care has improved greatly, making treatment more manageable than in the past. Hormone therapy, blocking cancer's fuel. For hormone receptor-positive breast cancers, hormone therapy is a cornerstone of treatment. These medications work by lowering hormone levels, blocking hormone receptors on cancer cells. Hormone therapy can significantly reduce the risk of recurrence and is often taken for several years. Targeted therapy and precision medicine. Targeted therapies focus on specific molecular features of cancer cells. For example, HER2-positive breast cancers respond to medications that block the HER2 protein. Doctors now use genomic testing to analyze the genetic profile of a tumor. This allows treatment to be tailored more precisely, avoiding unnecessary therapies and improving outcomes. Integrative and supportive care. Modern breast cancer care goes beyond tumor treatment. Many centers now focus on integrative oncology, which addresses pain fatigue, emotional well-being, nutrition, mental health. Supporting the whole person improves treatment tolerance and quality of life. why there is real hope. Today is one of the most hopeful periods in the history of breast cancer treatment. Early detection, personalized therapies, and ongoing research have dramatically improved survival rates. Many women now live long, full lives after a breast cancer diagnosis. And even with advanced disease, treatments can often control cancer for years. Knowledge empowers patients to make informed decisions, ask better questions, and participate actively in their care. Breast cancer is complex, but it is also understood better today than ever before. Each diagnosis is unique, and each treatment plan is designed around the individual, not just the disease. Understanding how breast cancer develops and how doctors treat it can transform fear into clarity and uncertainty into informed strength. If this video helped you better understand breast cancer from a scientific and compassionate perspective, please consider subscribing to this channel. We share evidence-based education, expert insights, and supportive content designed to inform, empower, and comfort those affected by cancer.